as a Stockport, we've looked at improving communication with the whole of our team, the whole of our caseload. So the title is to represent the fact that at the moment we're both doing more virtual working with COVID and all the demands and challenges of that, and also that we're using more technology nowadays, and so that in that way our communication has changed a lot. So both means that we're doing more than just face-to-face communication and working with the challenges of learning those. So it's meant, so we're trying to say that we're not being more distanced from our patients, that we're trying to use these methods to be closer to them. So this is, okay, so this is our team. We've obviously had to do a photo. Now on our slide, it brings up our names, but it doesn't seem to have done that on the one we're sharing, but we're all there. We haven't got a dietitian at the moment. We're just in the process of recruiting, but that's us lot. Oh, hang on. Oh, is it doing it? There we go. Oh, I had to press and it's pressing down. Yeah, I didn't know it did that. Yeah, so that's us. Okay. So then looking at our project purpose, again, we weren't quite sure how to word this because it's just about utilising all opportunities we can to develop communication with all children, young people and families. We were aware that we had areas for improvement that we needed to do based on our PREM outcomes from this year. We submitted an extremely high number of our caseload. We have a large caseload of over 190 patients. A large percentage of children and young people and parents submitted to that during clinic, when they came to clinic on the iPads. And so that brought our results. We had lots and lots of positive comments, but statistically we came down as an outlier on their feedback. So we wanted to explore that further and look at how we communicate with them better. And then we also ourselves did a transition survey with the young people of 16 to 19 by a monkey survey, and we've looked at the feedback from that and about how they like to be communicated with. So what we have learned on our journey is from these things is that young people prefer mobile, text and app communications, that we as a team need to listen to what the children and young people and families want from us, from our service, and how we can meet those needs. We need to find out how we get that feedback. One of the things we found out from the PREM was that the families want increased access to psychology and dietetic support, and we wanted to look at how we could do that more widely than just having appointments with these members of the team. So what we've done so far as part of the QI process is that we've introduced weekly QI meetings. So we have a clinical team meeting weekly, which doesn't involve the admin on our team, but what this process has allowed us to do is to involve the admin on our team, which has been amazing. We found using their skills has really enhanced our service, and not just for the QI. We've introduced a clinic sheet. So we already have a clinic feedback sheet that we give to the families for them to go home with when they come to clinic. We write down like an aid memoir of what we've talked about. And what we've added to that is what is going well, to give them some praise points to highlight to them so that we're focusing on the positives for them. We've also introduced positive praise stickers in clinic to give out. Now, both of these things work better on face-to-face clinics, so we are looking at emailing out or sending out the what is going well praise points virtually as well. Rolling out we're engaged in the initial phase 1 process of that, and we're utilising the QI process to drive that forward as well. So this will allow us to enable us to share resources from all members of the team, but including psychology and dietetics, to the different groups of people that we want to send those to, or to everybody. One of the things in PREM, one of the comments we got was that we ask the same things in clinic each time they come, and obviously we do have to have some structure there. But one of the things we've done is devise an all about me sheet and sort of age banded that, so that there's things that we can keep in our notes that we know about them, their likes and dislikes, where they're up to with college and school, or hobbies, etc. And then we're in the midst of devising a monkey survey questionnaire to utilise that. You can have 10 questions, can't you, free using a monkey survey to get some feedback from the families about what they want from the service. But that's something that we're just starting to work on. The barriers and challenges we found to that reflect some of what Salford have said. So time, and massively hard, isn't it? Juggling all the clinical priorities that we have, all the demands on the service. We just seem to get busier and busier with everything that we have to do, not just new patients, but all the challenges from that. I think COVID has put a massive challenge on all of us, everybody working in the NHS, but hugely on the families too. So, right, okay. So they're wearing the masks, having to do virtual clinics, how we communicate in a team, the fact that we can't just sit together without masks off. And then we've had the challenge of learning about the QI process and how we do fishbone and the process mapping and everything, all sorts of different ways, trying to work out what our aims are. And then how we've reduced those challenges by, I think all the team have worked really hard to communicate well with the families. We've had DigiBete team training. We've found the time to do the QI project as much as we can. And we're utilising different team members' different skills based on their different personalities, but also their different professional skills. I've got one more slide there. Okay, so we just what the learning point, what have we learned? We've learned that we can achieve together if we make time to do that as a team. We've listened to the children and young people and families, and we need to do that more. We're using different platforms to improve our communication, so both paper and virtual, and using the apps, all different forms of communication, and making that time for our team project working. And I'll probably just run over.
7 minutes.
Oh, right, okay, that's it.
Amazing.